and it's a major abdominal surgery. It can cause infertility later. Multiple cesareans are really disruptive, like you said, for the mother's body. But yeah, of course, like women's empowerment in the name of selling false information
It is
is where we are.
feminism gone in the wrong direction.
Yeah.
Actually, feminism should tell women that their bodies are beautiful, they are powerful, and they are designed to give birth, and this is the most powerful thing only women can do.
This is the Birth Agni podcast, the fire that brings us alive, that burns myths and opens a channel of authentic natural birth stories. This show debunks the many myths of the medicalized births, showcases the plethora of choices a pregnant couple can make to embark on their empowered birth journey. I'm Divya Kapoor, a certified birth and lactation counselor and an aspiring traditional birth attendant. Let's get the flames blazing high. This is the Birth Better series, which aims to remove the dust on how birth is being viewed in the mainstream as pain and suffering, as against a possibility for every woman to embrace her highest powers. Tapasya and I sit together, unraveling significant truths about the beautiful births that many women are capable of having. Tapasya is a natural childbirth consultant, a doula, and a birth keeper who provides holistic care to women who want to birth in their entirety and complete embrace of the divine. Tapasya, I get asked this question a lot because this work of birth education, doula, midwifery is so new in India. What is even birth education? Who are you as a birth educator? A mother can just go to the doctor and ask questions. She can take suggestions from her family and friends and assume that she'll be guided in labor. And, yeah, so why birth education?
Okay, so let's go a little bit into the history of it. In 1960s, in Western countries especially, it was seen that slowly the medicalization of birth is happening. Lots of procedures are being done, lots of drugs are being used, and the rate of cesarean section is slowly increasing. And then the International Organization of Childbirth Education was formed in 1960s. So from there, it has taken up the work of teaching women, first of all, how their body works. Secondly, what are the interventions in birth that are going on in hospitals. And thirdly, how you can prepare yourself for labor and birth in that setting. Or then slowly, when more women were going back towards home births, they started taking it in deeper direction, where how you can prepare to give birth on your own without much medical need, or with midwives or whatever. So this whole gamut of birth education started from there. So if a lay person asks me what is a birth educator, I will tell her that I do this work of telling women how their body works, to counsel their family to support themselves in labor, and what are the hospital interventions. Because the moment you go to the hospital, your labor is going to be monitored and put in a time frame. So how
Hmm.
you can support yourself better to increase your chances of natural birth. And of course, if they want other options than the medical system, then I should be able to tell them what are their other options, like midwifery care, birth centers, home birth, or whatever it might be.
So, in nutshell, the organization did realize that births in the hospitals needed better preparation because it
Ye-
was not working. The mortality rate is not decreasing. The surgical births have increased over the years. So, in the name of safe births, yet there is so much more that needs to be done to be able to improve maternal care. So it stems from there, from the very organizations that are that are in the healthcare. They want you to take education so that their statistics improve, which have not over these years. And also, coming from what you just said, informed decisions is something that we want mothers to be able to take. So, what are informed decisions?
Actually, informed concept of informed decision or informed consent in the first place is there. It has always been there in medical literature, in medical practice. It's another thing that it's not practiced as much, but concept itself is that you have to explain the procedures and drugs that are being used in the treatment of the patient, and the patient has all the right to say yes or deny everything altogether, or some parts of it. The ethical moral obligation on the part of medical system is that patient's consent has to be obtained every time before you do any procedure. And informed decision is the other part of the coin, where I know what is being done here, and I fully understand the pros and cons of it. I fully understand if there are any side effects of these drugs, those are have been explained to me, and I am saying either yes or no. For example, if a woman is offered oxytocin, pitocin, it is not oxytocin, it is synthetic, in labor, she has to be explained that pitocin comes with risks of 1, 2, 3, 4. There are many risks, right? Hyperactivity of the uterus, baby going into distress, too much pain. Not even just that, but after birth also, synthetic pitocin messes up with your natural flow of oxytocin, so it is going to affect your breastfeeding, bonding, immediate postpartum, etc., etc. So all this, if it is explained to a mom, she might say, okay, I do not want this, I want to opt for walking or climbing stairs or being with my partner, more intimate with my partner, which will give me more natural oxytocin. Or she might say, okay, we are in this labor for a long time, I want to augment it, I want it to finish. Then she might opt for another thing.
Right.
Also, like when epidural is offered, all the pros and cons are explained to her, and then she can opt whether she wants it or not. That is an example of an informed decision, where nurses are putting some injection in your IV and you are not even told what it is, what it
Yes.
does. You are being given antibiotics because your waters are open, but you are not explained what are the pros and cons of using antibiotics in birth. And there are many cons for the babies.
Right, and the National Human Rights Commission of India does give you. It's not just a global thing. India in itself has those patients' rights where it gives you the right to informed consent. So even if you did not know that you would be given an IV with maybe glucose, with induction, if you're being given all those things, you've not been asked, you've not been told, but you were made to sign a form wherein you gave your consent for anything and everything that happens, and gave your consent that I'm being told everything, even if you're not told what's there in the form. So this is why hospitals make you fill up a form for anything and everything that you do with them. So the authority lies with you, which is why it's so important to take up birth education. When the authority lies with you, and if you do not know anything, you will not be able to speak up for yourself in the first place. And oxytocin, I wanted to elaborate on oxytocin for the mothers, that oxytocin is the hormone, the natural hormone, the love hormone of the body, which is the pleasure hormone in sex. And this is the hormone that helps uterus contract, and it's the very hormone that makes you go into labor. So sometimes when there are so many reasons that may be put forward for you to take an induction even before your natural labor starts, so that is an artificial hormone that's put on your body, and it suppresses the natural hormonal system in your body. Moreover, the pain with an induction is far more than a pain with a normal spontaneous labor. So those are the things, of course, that mothers should be told before they very with an open mind are able to take the decision whether to go which way, like the other side of the coin, like you said, should also be presented to them.
Yeah. And also, when you're talking about consent and signing forms, there is an underlying consent. When I'm going to the hospital, I consent to them doing, whatever is needed to be done to save me.
Yes.
That is another thing to consider, that I am already giving some kind of consent to the hospital of
Mhm.
treating me. Still,
Right.
I have the right to be explained the procedures every time something new has been introduced.
Yeah, and in a lot of cases, mothers come up and tell us that they asked a few questions. The doctor was like, "Do you want to be a doctor? Why are you trying to do all of this? Why do you want to learn so much?" Or sometimes they are not being answered to, their husbands are being answered to. Like sometimes they just pass on the questions to their husbands because they are better answer or explain the procedures than themselves. So if someone is not giving you the answers, you need to really think about in which hands you are, because every medical professional is a human being, comes with its own life experiences, perceptions, the way they are as a person. So that will reflect in their job. It's very
Yeah.
important to be able to choose and take a second opinion. If any case you have a doubt, do not think that this is how everybody works. Not every doctor will not explain to you. A lot of doctors will sit down with you today and explain, but a vast majority yet may not. So one of the things that I've also experienced, tapasya, and this is when a lot of mothers, even if they know about birth classes, if they've heard about their friends taking it, if they've heard about the importance of it, sometimes they're still not sure whether to go for it, because in our culture we are telling mothers a lot of stories, a lot of horror stories around birth, and sometimes they just want to shut themselves off from all these stories. I remember a friend tell me that her mother gave birth at the age of 19 and had such bad pain that she just didn't want to take it. She had, so in those cases, how do you think mothers should be counseled? Because we know that birth education is very important, and not really putting it on the mothers, but just presenting them with the options where why birth education, whereas why not?
When we talk about pain in birth, we have to explain them where is this pain coming from, like physiologically also and psychologically as well.
Hmm.
And also this concept that one does not have to suffer through the pain. One can ride the pain, one can prepare oneself with the techniques to overcome that pain. If the labor was so painful, we wouldn't be so many on this planet, right? Because labor at the end, when the baby comes out, you forget all the pain.
Right, right.
When somebody explain this to them in a professional manner, in a very in a manner that they will understand, and someone shows them techniques that can be used to tackle pain, and also tell them why some women have painful traumatic experience in hospitals because of certain procedures, not letting them using the bathroom and using the catheter instead. So all these things, when we explain in my birth classes, their perception of pain changes, and they're
Right.
more ready to accept that labor is going to be intense, but it doesn't have to be painful and a suffering.
So birth education therein helps you with professional counseling. You'll be able to have the techniques at hand to be able to counter those fears, or at least work on them.
Exactly.
The other day on Women's Day, we were talking, and you were telling me that, why are we even celebrating Women's Day with so much enthusiasm these days? Because it stems from patriarchy. And here I kind of think that a lot of mothers think that they have an option available to be able to undergo cesarean as a form of women's empowerment, that I don't want to go to labor and I'm empowered to be able to take that decision, which is absolutely fine. But the problem here is that if you're only presented with the options that have vested interests, it mimics slavery. It's very similar to just assisting the business of birth. Whereas if we were really to solve the problem of labor pain, like you said, we would counsel mothers on how they can take it, how they can reduce it, and present them with the stories of where mothers could actually do it and came out euphoric. The euphoria is another thing at the end of the day.
Yeah, it's very under highlighted thing. The birth euphoria, or the high that you get from birth. It's literally a high. The highest amount of oxytocin your brain is going to produce when you see your baby, when you breastfeed your baby immediately after birth. And this is
This is
ecstasy. Women are
orgasm.
not
Yeah.
told that, they are kept away from this ecstasy. selling cesareans as an option to avoid pain altogether is superficial, because you are undergoing pain for next 6 months, pain of recovery, and that is not easy.
Exactly.
I
Yeah.
have so many women telling me that they still have back pain where their anesthesia was put in. Once the climate starts getting colder, or if it rains, or if it, they will trigger their pains. At least no hospitals that I know in India, might be there are a few, yeah, who practice gentle cesarean. At least they show the baby after the birth, they put the baby on the chest of the mom, even if she's not able to move, somebody holds the baby, or they give the baby to the father for skin to skin. These practices are not even considered important, and nobody explains this to women. Nobody explains this, that cesarean is no pain for like for a few hours, but pain for longer time. And also statistically, a complicated risk of cesarean is when you have multiple cesareans, your chances of having endometriosis, that is your uterine tissue growing out of your uterus, or having difficult placentation in your coming pregnancies, is very very high. It
Yeah.
increases your chances of having complications of your reproductive system, and that is not being explained. Even the cesarean itself has a whopping 8% risk of having that the mother or a baby might have permanent injury, and it
Yeah.
never comes to forefront because nobody talks about it.
Because they have their own interests and not telling you this
Exactly.
and
and
telling you that it's
and
safe.
and hospitals do not publish their statistics, the especially their birth statistics, yearly.
Cesarean was introduced as an emergency if in case we need to save the mother and the baby, which is a very small percentage as against what it is being used for today, which puts a huge question on the system. Have women changed, or has their bodies really drastically changed, or is there something wrong that a lot of mothers are being saved today in birth, wherein birth is such a natural normal procedure and it's a major abdominal surgery. It can cause infertility later. Multiple cesareans are really disruptive, like you said, for the mother's body. But yeah, of course, like women's empowerment in the name of selling false information
It is
is where we are.
feminism gone in the wrong direction.
Yeah.
Actually, feminism should tell women that their bodies are beautiful, they are powerful, and they are designed to give birth, and this is the most powerful thing only women can do.
Yeah, to
So,
have the level of
exactly,
pleasure at the end of a birth, which is so much more than a normal orgasm of an intimacy, is something we're not telling mothers. So they wouldn't even prepare for that because they do not know that that exists and that happens and
exactly.
that's possible. Where would the difference be if a mother was educated in labor, she was counseled with continuous support, which is what we offer, whereas when a mother is not taking birth classes, where does the difference lie, especially in the Indian ecosystem?
I will start with the EDDs, expected date of delivery, because
Yeah.
almost all of the women are told that their babies will die if their pregnancy goes beyond 40 weeks.
Yeah, the
And
baby's head will grow, the baby will grow beyond expected
yeah, I
proportions,
mean,
as if I don't know what
too
miracle
large,
will
too
happen.
small, the liquor
Yeah.
will reduce, the amniotic fluid will be so low, this that. A well educated mom, well educated in birth, I'm saying, because most of well educated women are don't know what happens in birth, and they blindly follow what is being told to them. uh,
Yeah.
Underlying asterisks. So well educated in birth, a woman will say, all right, I understand the risks of going beyond 40 weeks, but I want to wait for my natural labor to start. A mom who has taken birth classes, if she's even if she's little worried about going beyond 40 weeks, she can say that I know there are tools to see how my baby and placenta are doing after 40 weeks. So we can do NSTs and CTGs and color Dopplers and whatnot. This is the first step. Secondly, women don't even know that there is something called a Bishop score. which
Mhm.
has to be gauged, that if the woman's cervix and uterus are ready for induction.
Mhm. Yeah.
Because not all inductions are going to induce labor. Most of the
Majority
60%
of them.
inductions fail, and they end up in emergency cesarean sections. So that's where a birth educated mom is going to make a difference in taking her own decisions.
Yeah.
And things like, oh, there is meconium in the liquor. So first of all, how do you know there is meconium if the water have not broken?
I was told
And
this.
meconium, you cannot make out if there is a meconium in an ultrasound unless and until the water is broken.
Not
So
even ultrasound. I think they just look at the fetal heart rate, which is normally accelerating and deaccelerating. It does accelerate and
exactly,
deaccelerate in your labor. And they'll say, oh my God, it's the waveform is changing. So the
yeah.
baby must be in distress. And meconium is one of the very
And the
common reasons
doctor
they give
are
you.
not telling women that they are breaking their waters. Actually, AROM,
Yeah,
artificial rupture of membranes, is a big procedure, but it has its own risks. It can introduce infection, it can do so many things. But a birth educated mom will say, please leave my waters alone,
exactly.
don't break my waters.
Yeah,
But a mom who is not informed, who will say, okay, do whatever you feel, and then you break the waters, then you find meconium stained liquor. And all meconium stained liquid does not mean that baby is in distress. All the amniotic fluid that we see is the urine of the baby, so it is getting recycled. So it does not mean that baby is in a constant distress. It might mean that baby underwent some oxygen insult and it corrected itself. And just like when we are scared we lose our bowels, just like that babies also sometimes lose their bowels, but it does not mean that they will aspirate that meconium and that will go in their lungs, and all the risks, the story of the risk that is being told to women. A birth educated family will also take informed decisions. Because we have often seen that a mother is saying intuitively that no, I don't need this intervention, but then
yeah,
the family says, oh, let the doctor do what she wants to do,
yes,
okay, don't
yeah.
ask questions. So here is the difference that is.
Also, in a lot of these cases, it's not that you will not be explained what is happening. So I broke the waters because I want to make sure that the induction, since it didn't work, I want to make it work. So I broke your waters. Oh my God, there's meconium, which I didn't realize. Wherein in 80% of the birds there is meconium. I didn't realize, and then I complicated the case because once I break your waters, the meconium comes in direct contact with the baby, which in an amniotic fluid it wasn't. So it wasn't a risk factor when it was diluted in the amniotic fluid. You're just taking out all the dilution, and it becomes thick and present, and then it can actually be a risk factor.
Yes, we can say that. But most of the times, breaking of the waters comes with the risk of cord prolapsing. And
Yeah.
of course, I mean,
Passing bowels is a normal natural process, but if you interfere with that normal natural process and break the waters, then you are actually making it so thick and dense. In that case, the baby wants it aspires it directly aspires a thick dense meconium, and in that case you can create a problem of distress. And then of course cesareans, and yeah, of course saving the mother is another thing that is happening. So you will be explained the procedures, but if you do not know where all it began, the cascade of interventions that led to the problem in a managed birth, unless you are able to protect yourself right at the beginning and take those informed decisions from the very start, one intervention, maybe just an induction when it was not required, will lead to 10 other managements of your birth and labor, and you will feel that you're being saved, but you did not know the very first step that was taken was not required, that led to all those managements, the need of the management, whereas if you were left alone, you would have done beautifully.
exactly.
Also, in education, one of the things that I'm also seeing is, even if mothers are told all these things, sometimes there is such a strong trust of the system. At the end of the day, even as we birth educators, as counselors, we are here to provide all the sides of the coin. At that point in time, sometimes everything goes into the hand of the system because it's been so glorified as a safe place. And not just mothers. I'm not saying mothers because sometimes they're not even heard. Their intuition is not even heard. The families want to stick to system and not able to advocate for themselves. So it's not birth educators, it's not us, birth workers, who will be able to counsel for you. We'll only be able to counsel you, and then you'll advocate for yourself and take your decisions.
Sometimes families think that birth educators are asking us to distrust or mistrust the system.
Yes. I think you
Actually,
said
we
it
are not.
just right. Yeah, that's what I
We are
also
not
a lot of the
trying
times.
to make
Yeah.
you have a distrust in the system. We
Yeah.
want
I
you to
have,
trust the system, but we want
yeah.
you to know what it is doing to you, because if the only motive of the system was well-being of the mother and the baby, I would accept blindly whatever they did. But
Mhm.
unfortunately, we do not see the only motives of corporate hospitals, even of small clinics. Of they have their own economy. They
Mm.
want to have a certain cesarean rate so that their economic side is sustained. And the third consideration is so much fear of litigation that neither
Mhm.
families nor doctors want to take any risk. And I
Yeah.
don't know why natural birth only is considered a risk, while cesarean is also, it comes with risks. But
Yeah.
it is presented as the safest option. It is sold as
So
safest
does.
option, and natural
Yeah.
birth is always portrayed as something very difficult that a woman's body goes through. And I have heard in person doctors telling, why do you want to opt for vaginal birth, because you will anyway will be given episiotomy, or you will tear horribly and your sex life will be ruined for life. Why do you want to do that to yourself? Let's stay away from all the pelvic floor problems. Does not mean that people who undergo cesarean will never have pelvic floor issues in later in their life.
Yeah, not going
Yeah.
into the details of what that means, but this is so crucial what you've brought up. Mothers sometimes are defending why I chose this place. We do not really want to force you into anything. We don't want to say you go, but we see the red flags because we see both the sides of the coin. We see births which are absolutely beautiful and wherein things were not done to mothers.
We have to
Quite
ask
like.
this question, why 3 out of 5 women are coming out with some kind of birth trauma out of the hospital. We
Mhm.
have to, it's high time we start asking questions. We cannot accept such high cesarean rates, we cannot accept such high induction rates, and almost 98% of episiotomies. Why are we accepting it as a culture?
And in India, we are doing it at a lot more rapid scale than the West. Of course, the West has also done its part, but with newer researchers, the research says that episiotomy is not required in every case, and you shouldn't be shaved. That induction is not required. WHO clearly says even if you go beyond 40 weeks, we do say yes, you can go for inductions, but it is a case to case analysis wherein Bishop score comes in, where law is also one of the things, regional births, your geographical location, the government, the system, everything comes into play on your reproductive cycle. It's just not you, about you. It's not about your capacity to give birth. It's the law. If the law is not centered around the well-being of the mother and just the baby, they are going to just make sure that the baby comes out. That's what my doctor told me when I asked her, what did I do wrong to be able to undergo a cesarean? Because I felt that everything was going right. Because the nurses at my head said, Sir, that is the owner of the hospital, and this was a family hospital, family nursing home, kept asking the nurses, what's happening to this case? And I could hear the nurses right at my head. So, and coming to where the doctor told me, when I asked her, when I questioned why everything that happened the way it did, she told me there were laws about. She actually did confess to me that there are laws about the safety of the baby and not the mother. We are not focused on the mother as much as we are focused on the baby, and in all of this we just lose the spiritual angle that the baby and the mother are connected. Even if you physically get the baby out of the body of the mother, it will undergo trauma. Whereas in an undisturbed, with lack of interventions, even in a hospital birth, of course the degree differs there, but even in a hospital birth, if you are, when you where you are hurt, where there are very less interventions, it does affect the emotional state of the baby and the mother, where they are brought together skin to skin. When the mother is happy, it just goes into
Exactly,
a beautiful
exactly.
union thereafter.
The policy of government of India is having 100% institutional deliveries. In states like Tamil Nadu, they are literally pursuing every mother to get admitted at 40 weeks or beyond before 40 weeks.
These are government organizations,
Yes,
ASHA
yes,
workers, the ones
yes,
you were speaking
yes.
to me the
The
other
whole
day.
system. Once
Yeah.
a woman is registered, she's being followed up, which is a good thing in a way to reduce maternal mortality and risks. But doing it to every woman,
Like, get the research done on how much births at home that are still happening in a large part of our country, which is why our overall cesarean rates are not that high, whereas urban cesarean rates are so high. We
nobody
kind of just
asks those
nullify.
women what was your level of satisfaction. And women
Yes.
who have had home births, they will tell you what was the level of satisfaction. But the system is not going to change because it has its own motives to work the way it has to work. The
Yeah.
care receivers, they have to change. When they
Yeah.
make the demand, the changes starts coming.
And when do you think birth education should begin? Because that's also very important, because it's something wherein it's a lot of work when you are unlearning something, when you have to
Yes.
go through the stories of your own family births. What is the perception of my husband? What's the perception of my family? Now, that the trust factor with an educator is also something that will come up, because I've often seen.
Okay, so first part of your question is, where does birth education begin?
Right.
It begins at puberty, it begins at menarche, when telling them at the very beginning that this is something wonderful that their body is going through, and this is what is giving them the power to create life.
Yeah.
And it begins there of, telling women that their bodies are something beautiful, there is nothing to be ashamed of. And
Yeah.
then it begins. I started my education from preconception. How can I make my environment toxin free so that I increase my fertility? What are the foods I can eat? What are the activities I can do? Where are the areas where we need to work as a couple? We are embarking on a journey of parenthood. We need to iron
Yeah.
out so many things that we have in between us, because we cannot carry them into parenthood, because we have to work as a team. So there it begins. Then when you have that level of understanding with your partner, it's easy for a birth educator to help them understand what is this whole process about. Pregnancy, birth, postpartum, those are very, those are rites of passages in the life of a woman.
Yes.
So birth education starts from the puberty and goes until, menopause. Because this whole childbearing continuum of the woman, she's undergoing so much physically, emotionally, mentally. This wisdom has to be passed on from generations to generations. But the problem is we are passing on generational trauma, because our mothers, our grandmothers, not grandmothers, but for our generation, our mothers, most of them, many of them in urban areas have undergone traumatic C-sections,
Traumatic normal births also. A vaginal
traumatic
birth
normal
was
births
not
as well.
necessarily a
Mhm.
happy birth. When you're made to lie down,
Yeah,
undergo intense pain, you were not supposed to
yeah,
undergo
yeah.
intense pain if you were allowed to move.
Divya, you and me also talked to the eyes. Something
Yeah.
she was telling us, that a woman had first home birth and then she went to the hospital, and then she saw what is done to the, she's made to lie down and nurses are shouting at her and she's given an episiotomy, etc. In the third birth, she says, I'm going to the hospital over my dead body, I'm not going to, because she has seen both the
See.
births.
Yeah.
And she says, I cannot imagine myself giving birth in captivity in that situation. So this is a very stark example where you see the differences. But you don't have to go through traumatic birth. There are tools like birth educators and doulas and midwives, which you can use to make your birth more empowering experience. You don't have to have a first traumatic birth and first cesarean to go and understand what is a VBAC, what is a vaginal birth after cesarean section, and how ecstatic it can be, etc. It doesn't have to be that way. We can cut down primary cesarean rate.
Starting in preconception is also very important, is because then you are not carrying a life, and that is when you can prepare with an open mind and maybe able to better research your chances to be able to go. to a different city, maybe. And a lot of mothers have done that, to be able to choose a birth center if you want to still,
Or a better hospital that is natural birth supportive, or a hospital that has high cesarean rates, because we don't even ask what is your statistics, what are your last year's statistics for your cesarean rates. We don't
it's
ask
very
that because we
difficult.
think this is too
Yeah.
rude.
Yes, I've done that. I always tell mothers that go and ask. Don't ask the doctor. Go and ask at the reception desk. I mean, the admin should be able to tell you. But I don't think so in all of
No, they
my
don't
like
display
other.
it. I have seen only Fernandez Hospital in Hyderabad displaying all their rates of cesarean, twin
Because they,
deliveries, breech deliveries,
yeah,
whatever, because they're
because they're still
maintaining that
centered on, yeah, because it's still
transparency.
centered on normal, right? If
Yeah,
you are working towards preparing a better ecosystem for women, you will display it. It's a proud thing to display. But other
exactly.
than that, yeah, you wouldn't. But even if they're not telling you, us asking the system,
No,
where
the
do the statistics
responsibility
lie?
lies
At
with
least
us. I
us,
totally
yeah.
think the responsibility of obtaining answers from the system lies with the family, because nobody is going to give you answers on the plate. You have to dig for them and you have to know what is going on,
Yeah,
because until and unless you dig deeper, you will never know what happened to you in that birth.
yeah, and it will
So
lurk
yeah, so we
often.
are signing so many forms that are ultimately saying that hospital is not responsible if anything happens. We are
Exactly.
doing our best. We are not responsible for even anything happens to you, because we are making ourselves legally so protected that you cannot sue us. So where does the responsibility lie? Who is responsible for me and my baby?
You,
Me.
wherever you go, home birth, hospital, birth
Exactly.
center, you are responsible. Take it in your hands.
Exactly. So claiming that radical self responsibility is very, very important when you embark on a conscious journey of being parents.
Yeah, even if they have questions, it's the best time to ask questions. Ask questions.
Exactly.
That's what we want you to do. If anything makes you scared, if it's the system, if it's us, if it's anybody else, ask questions. You'll
Ask
find the answer.
questions.
Yeah. There is a field beyond fear where the body is empowered to take on labor and birth. To land there, it is crucial to take birth education. To enroll into our unique labor and birth preparation course, reach out to us at www.birthagni.com or scroll through all available prenatal and postnatal preparation classes. Thank you for listening, all in the spirit of birth, womanhood, and freedom. Remember, you got the bar. This podcast is about physiological birth and does not offer or claim to provide medical knowledge or diagnosis.